I want to introduce the new set of people that have come in for our last session this afternoon. We have Dr. Navakar, who is the director of AIMS Raipur. We have Dr. Peter John Victor, from the director of CMC Velo. Here we have the director of AIMS in Bhopal. So welcome, and Dr. Chabra from Vasant Kunj Spinal Injury Center. At this point in time, I want to before I get into the new folks that have joined us, I just want to have a quick recap with both Dr. Sanjeev Kumar and Dipanjan. We started with the flattening of the curve, the preparedness for what is coming on, a special case in terms of oncology. And as we now we've got the senior institute directors also here. This is where the capacities are. What is it that we need to be preparing for is a question from a public health perspective. And then I'll look at it from a very operational, specific perspective to Dipanjan. First, Dr. Sanjeev Kumar.
Flattening of the curve means we need to reduce the number of cases. I gave an example: if one person infects 4, in 5 rounds of transmission, you will have 65,000 cases. If you reduce it to 1, you will only have 16 cases. This is what it means, so that you can mobilize resources, you can build up capacity, which is called surge capacity, and prepare the system briefly. I wanted to add 2 things from the previous panel. There, if you develop symptoms, don't have to rush from one hospital to the other. In every state, the advisory we issued from Indian Public Health Association, every state has given out a number. All that number, they will advise you if you need to go. They will talk to you about your symptoms and then tell you where to go. Or in some of the cases, they may also be able to send somebody home to pick you up. So for example, in Delhi, the number is 011 2230 715. For every state has given out that number. Until we were getting the print newspaper, there was one full page advertisement which was giving this number and do's and don'ts. So that information was not given in the second panel. I want to add that. Third point I want to add is there are 11 countries in the lockdown, not just India. 1/3 of the world's population is in lockdown, including developed countries, France and Italy, for example, including the developing countries, Jordan, South Africa, for example. There are 15 countries in partial lockdown. At least there may be more. US and Philippines are there. And there are closed border in another 14 countries, including Canada and Australia. Third point I want to emphasize, we are contributing to stigma if we are scaring people. And that stigma is affecting healthcare providers as well, not just the patient. That is the third point from public health point of view we need to be taking care of. Thank you.
Sure, thank you. Just Dr. Mangal, you were saying, Dean IIHMR from Jaipur, you were saying something.
I was listening this conversation of the prior group very carefully, and it was very, very informative that in specific situations like patients suffering from cancer and those who are on immunosuppressive therapies, how to continue to provide them services and how to protect them from catching infectious diseases like COVID. Now, in a specific situation of pandemic like this, surge capacities can be created because the Epidemic Act is in place. Now, I think this is a case, very classic case, where we need to look at the basic healthcare delivery structures and processes. An ideal situation would be where the care for critically ill people from other diseases continues to be there, and the system is able to take care of new challenges, whether it is COVID or any other illness or communicable diseases in future. And from that perspective, I think this is an opportunity to look at the way the public health competencies and capacities are created and utilized in our country. I'm really concerned about the fact that, and I'm also appreciating that all of us are coming together in this very specific situation, and everybody is contributing their bit. But by design, what is the plan, or what should be the plan in future, that we do have epidemiologists, we do have public health people, and we do have a plan in place to enhance the public health competencies of large number of paramedics to deal with
Absolutely.
enormous amount of number of cases that we may have to deal. And hopefully we will be successful in this phase of lockdown to curtail and cut down the surge, and we will flatten the curve. But otherwise, what is our what is our thought for future to prepare ourselves? One that I would like to add very quickly, that the public health and epidemiology enables us to deal with new diseases even if we do not have any clue of what causes them or any clue of what is the diagnosis. That has been
right, sir. Right, sir. So
this focuses our attention.
Sure. May I request that because Dipanjan, I mean, if you very quickly kind of one point very quick before, because we are very, very busy heads of institutions here. If you can very quickly summarize, and then I get to the directors here.
Thank you, Bobby. My quick, context and summarization, and also we have esteemed directors. See, as we progress in the epidemic, we are going to have more number of cases. It's the larger institutions which will take care of the serious cases. It's the proportion of the cases which is going to get serious, maybe 10 to 15%, and you will require. So, that's the next phase of epidemic plan. When you do a phasing, you have the phase 1, phase 2. We're still, as of now, not gone into the phase 3, as per the recent reports of ICMR. But phase 3 would happen, in a large country like us. Whatever safety net you put in, it is bound to have some amount of seepage, some amount of problems. So obviously, the number of cases are going to go up maybe 2 weeks down the line, or maybe a week down the line. So the panel, which is esteemed panel, which is here, what are the kind of preparatory activities is being planned out there? What are the kind of isolations? What are the kind of other things? And that would probably take us through in reducing the number of deaths in this case. That's the epidemic control. That's one of the major things. Thank you.
Thank you. Thanks, Dipanjan. I mean, we have two AIMS directors. We have the CMC Fellow Director. We have Dr. Chabra from ISIC Delhi. One of the things that we saw in the last couple of days was in New York, they were basically saying medical graduates could graduate 3 months earlier, provided they were coming into service for the COVID response, right? And so there are countries that are beginning to look innovatively at where their surge capacity might come through. Each of you gentlemen are helming institutes of national importance, and you have training capacities. You also have got service delivery capacities. What is it that you are seeing right now from your respective positions as to what needs to be done? And may I start with Professor Sarman Singh from AIMS Bhopal.
Thank you and good afternoon, and sharing this. And I was just listening the previous panel also, and very rightly somebody said that is a one important aspect. But you started your introduction with the training part. So I would also start from the training part, because there was a last 2 weeks back, last fortnight, there was a hue and cry in parents and they said that what you are looking for when you are going to close the medical college. And obviously we waited for about few days, and then ultimately we realized that on the lines of AIMS Delhi, we also thought that why not let them go, because even if we keep them, even though we thought that at that time, of course now we have 2 cases of corona in Bhopal, but at that time we were not having any single case of COVID. But the anxiety of the parents, obviously one can understand. So we decided that even though they were safest in Bhopal, but we allowed them to go and to vacate the hostel. You very rightly said that some of the countries, they have also asked for final year students. We also asked to volunteer. That we didn't do something like that, they can graduate earlier, but definitely we thought that we might give some, certificate or something like appreciation. So that is there, definitely, but our interns, our junior residents, senior residents, all are working, and we have been, successful in, motivating them with various means, and they are with us. But as we discussed the previous, panelists also, and we all know that the number of cases is going to increase by, in all boundaries. Now, then question comes that our residents, including even though they have become doctors, they know all the things, nurses and doctors, even though they are meant for, but the COVID-19 has made such a dent in the understanding and psyche of even the healthcare workers that they are really scared. They are really scared, and the number one, because the COVID is such a highly infectious, virus. Number two, we don't have, PPEs. The supplies is making huge impact on the, consideration and the, hesitation of the healthcare workers to extend their services. And even if these are available, they are of, very, substandard quality. And even though the national government is also helpless, we have not been able to. Nevertheless, we at AIMS Bhopal, considering that obviously the pandemic touched Madhya Pradesh quite late, and so was Chhattisgarh also. So this central India, but we know that cases are going to come definitely. So now what we have done that we have identified one 2-floor building, which is usually earlier this was used for IUs, but now we have dedicated, so this can hold all patients and screen, also testing and sampling, everything can be done, and then if the samples are found positive, then obviously they can shift to the medical ward. So, and then medical ward also, then we have with symptoms and without symptoms. So means corona positive, asymptomatic, and then symptomatic also. So symptomatic obviously will go through third stage.
Yeah, so I mean, just kind of restricting ourselves to the training part of it. So, Dr. Victor, I mean, CMC Velo, again, a premier training center, also a place where people turn up for their treatments, things like that. How are you considering the training requirements or putting in more people out there at an earlier stage of their training into the actual case management scenarios?
Thank you. I just want to give a very brief background because I think I will be able to answer your question. Can you hear me? So we are normally running a 3,000-bedded facility with patients that come from all over the country and overseas. So we have good capacity. After the announcement of the lockdown by our Honorable Prime Minister, we have started looking at it in a slightly different perspective as to how we can create sufficient capacity to deal with all the patients from within the district. Ultimately, because of the lockdown, we feel that we need to provide enough capacity for all patients and to strategize and stratify patients of how many isolation beds we need and how many critical care beds we need and how we staff them. In terms of stratification, we know that moderately ill patients will need hospitalization. At CMC, we have already created 150 beds for moderate illness by reducing our elective surgeries and by reducing our outpatient and inpatient services. By next week, we will be able to double the capacity to 300 beds for potential patients. And we're working with the government. They want us to have 500 beds, and we're working towards that. We have a potential advantage here because we were already converting a student nurses hostel into an orthopedic block, which is due to be ready next month. That will give us 150 additional beds, including intensive care beds. We are also in the process of constructing a state-of-the-art trauma facility, which is 3 months from completion. And if it comes to that state, we will request permission from the government to expedite that process, that we can have another 1,500 bedded hospital ready in 3 months' time. And that has 215 beds. So in terms of intensive care, we currently have all intensive care put together about 130 beds, of which only 24 have been designated for SARI patients. And we will be able to add another 12 by next week and a further 12 in the following week. We feel that we can stretch intensive care capacity to 50. We have currently 1,600 doctors, half of whom are permanent faculty and another half for postgraduates and higher specialty trainees, and 3,000 nurses in.
Sorry, I was on mute. Thank you, Dr. Victor. I mean, every one of those numbers is so impressive when it's standing alone. I mean, a new facility of 1,500 beds coming in 3 months' time, or 150 intensive care beds, or 3,000 nurses that are there full time. On their own, they are extremely impressive. But what scares me is the denominator that you put in very early on, which is that your estimation is that you might be overwhelmed by 21,000 people. Right? And so that kind of gives us a scale that no matter how much we have, it still is going to be something that we're going to be stretched against. And so that's where we need a lot more of both planning and also devolution of some of the capabilities that we have to somebody else. Institutions like the AIMS and CMCs will have to provide the leadership and the models. How we kind of then get replicated down is going to be the challenge. And how we kind of do that. And so therefore, Dr. Nagakar, I mean, from AIMS Raipur, I mean, again, like Dr. Saman Singh said from Bhopal, Chhattisgarh seem to be, let's put it this way, not yet in the reckoning, so to say, the leaderboard of numbers, but already what is your planning there? If you may go ahead, please.
Thank you so much, Dr. John and the entire team of elite panelists. Yes, I think this preparedness, which has been a keyword, social distancing, another keyword that we've been hearing and we've been actually implementing for the last few weeks. We at AIMS Raipur have received the directives from the Ministry of Health and Family Welfare, Government of India, and accordingly even from the state government, that ours should be the nodal center for any cases that would be coming up in the state of Chhattisgarh. Our lab, which is the state VRDL lab, was the reference lab, and they have screened more than 300 samples as of now. Patients come daily for a separate dedicated center, which is for COVID-19. 6 patients are positive, of which 4 are already admitted in our hospital and are getting care from our expert doctors, nursing staff, and all the rest of the support staff. So, although it was with a trickle, but it has started. And that's where actually the key word of preparedness, comes in.
We are facing a grave crisis and we need to augment our human resource, infrastructure and equipment and be very innovative in order to meet this big challenge which faces us all. When it comes to human resource, the government can consider various measures to augment the human resource. Like there are a lot of people waiting for their examinations for their graduation, and there are precedences from UK where the General Medical Council of UK skipped the final examination and gave them a degree based on their past performances. Similarly in Italy, they cut short the duration of the graduation by as long as 10 months and gave them graduation without examinations. Similarly, there are a large number of people who have come in trained from China and Russia, and we can have them given a degree provisionally so that they can contribute to the human resource requirements of the country. When it comes to specialists, we have around 50,000 specialists waiting for an examination, and like the American model where they are either board eligible and then after the examination become board certified, we can give them the rights to practice right now and they can become board certified subsequently after the examinations are done. So similarly, we have a large number of specialists who are deregistered because their societies from which they are registered are no longer certified by the Medical Council of India. But in this hour of crisis, the government may consider letting them practice so that they can contribute to the human resource requirements of the country. Similarly, we need to gear up for the infrastructure. We need to have a large number of beds ready, whether that is in the government hospitals or in the private hospitals, or whether we have the stadia, the hotels, the railway coaches being geared up to provide medical facilities and hotels for quarantine facilities. There are a lot of things which can be considered. Also very important is to gear up the intensive care beds, as was clearly seen from the example of Germany and Italy, where the number of increased intensive care beds in Germany led to a substantial reduction in the mortality in this country as opposed to Italy, where the number of beds were low. In India, the number of beds are still lower, and we need to gear up so that we can have adequate intensive care beds and we can have adequate ventilators. We need to be innovative and think how we can have the local manufacturers come up with ways and means so that we can meet the needs of the country. Another requirement would be from the PPEs, personal protection equipment, which are needed in large number, the oxygen, the suction, and various measures like telemedicine, which the government has cleared now with fresh guidelines. This would play a big role if we were to meet the big challenge. So in a nutshell, in this hour of crisis, we need to pool resources, we need to gel like a team, we need to side with the government, and together we should be able to meet this big challenge and come out successfully. Thank you.
For many of you who have joined us on the YouTube channel, this is a unique experience for us. Earlier, we used to run conferences inside rooms that had only 200 people or 300 people, and they used to be closed door. This conversation for us has been the first time it's gone out. We don't know how many people have watched this, but I hope that whatever you've heard does not merely does not cause you alarm, but encourages you to think creatively, that there are solutions possible, and feed in. I mean, you have the YouTube channel where you're responding back to us, or you can write to us at the ISW Council website, or to each of the people that you have seen on the screen through the last 2.5 hours or so. Let the conversation go. This is a moment for us to mobilize and bring our best ideas together. Last thing, let's have social solidarity. We cannot have social distancing. We have to have social solidarity. We have to have physical distancing, whether it's at the cancer hospital, whether it is at our mediated through our tele health facilities or the calling and triage facilities, whichever way it is. Let's prevent ourselves from being at a position of risk and putting somebody else at risk. Wash hands properly. Make sure that if you're coughing, you're wearing a mask. The rest of you don't need to make a mask. In fact, I mean, I hope all of you that you're watching this on the YouTube, you would have realized that none of the people who have come here are wearing masks. None of them are actually out there coughing out. But those that are, you need to put a mask on, and you need to be making sure that you are also quarantining yourself, keeping yourself away from infecting somebody else. If you have a fever and if you have a chest tightening, please make that phone call number. I think Dr. Sanjeev Kumar gave us the Delhi numbers. I think there are numbers for every single state, and there are toll-free numbers. Please make those calls that you can get the appropriate guidance. Tests should not be limited. I know that we have talked about testing earlier on. I know that there is a thought that we should not be indiscriminately using tests, but as clinicians, as public health people, we know that what you don't know does not point you to where you need to go to. What you know is what helps you refine your approaches. And so therefore, figuring out, again, a national effort to get rough and ready testing or complementary signs that allow us to triage people in is important. And let's stand behind our medical care workers. It is very easy. Today, everybody is talking about them as demigods. Tomorrow, when things start going bad, and for many, many people, it will go bad, in the same breath, let's continue to support them. Let's not turn against them and say they did a bad job. Because face it, there will be bad outcomes. Not everybody is going to have a good outcome. And the very busy, very tired, very stretched medical care worker is going to be somebody who has done his or her best. They should not be stigmatized. They should not be pointed at. They should not be ostracized. They should not be acted in violence against. They need your highest care and support. And I hope that this message does go out when things get bad. Right now, everybody's looking at us with hopeful eyes. We will do our best, and we have the best brains, best intentions in place. Despite that, the burden may overwhelm us. Stand with us is all we would say. On behalf of the ISW Council, thank you so much for each one of you for having taken the time to come here. You may not have seen the people that have seen what you have said. But I believe the virtual world has the ability to kind of propagate your messages far beyond what we imagine. And so therefore, thank you for devoting your time, for making available whatever information that you have put together. Some of the things that we need to work together, we will be following up with you. But for everybody, thank you from the ISW Council for
Thank
having
you.
been with
Thank
us
you.
for the last
Thank you.
2.5 hours.
Thank you.
Thank you very much.
Thank you.